Hello there. If you are in this PowerPoint, you must be looking for more information about the multi-tiered system of supports, or the MTSS team here in Dillon School District 3. So throughout this presentation, we'll talk about what MTSS looks like in general, as well as more specifically of how we implement it here in LATA. MTSS is a system-level support that incorporates a whole child framework. And what that means is MTSS provides tiered supports for all students, as well as support for our educators and administrators, so they may also promote academic success more effectively and efficiently. MTSS encompasses the whole child, offering support academically, socially and emotionally, as well as behaviorally. By offering blended delivery, this means all students, all educators, and all hands on deck, because changes for our students often rely on the behavior of the adults in their lives. And all students receive scientific, research-based core instruction, which emphasizes their grade level standards and school-wide behavioral expectations. So MTSS has a fluidity to it that fluctuates level of intensity and intermingles tiers across the areas. When we're problem solving, we should consider wraparound support for the individual students and their families by building relationships with related service providers and community resources so that we may effectively address their behavior, academics, and social interventions. As I previously mentioned, all students receive scientific, research-based core instruction that emphasizes their grade level standards and our school-wide behavioral expectations. Tier 1 instruction is explicit, differentiated, and includes flexible grouping strategies and active student engagement. Offering high-quality instruction is critical in ensuring that 80% of our students' needs are met at Tier 1. By improving explicit instruction, differentiation strategies, and use of flexible grouping, this maximizes active student engagement. And MTSS is a system-level initiative which involves all team members by using screeners, offering a continuum of tiered support, utilizing progress monitoring tools, and by involving all team members in data-driven decision-making, we best support student success. We need a quality Tier 1 instruction in place prior to progressing to Tier 2. And what Tier 2 looks like: Tier 2 targets small groups that typically receive an additional 60 to 90 minutes of instruction on top of their core curriculum instruction each week. And this may look different across classrooms. You may have 2 or 3 30-minute intervention periods. Small groups become more intensive by increasing amounts of support in the form of encouragement, feedback, and positive reinforcement that's carefully scaffolded during instruction. Small groups in the elementary level have approximately 3 to 5 students. Then in the middle and high school, they're broken into Tier 2 support groups of 6 to 8. So, what do we mean by three-tiered instruction and intervention? Well, the MTSS process depends on a continuous data collection, which utilizes data assessment tools such as universal screening, progress monitoring, diagnostic data, and ongoing formative assessment. The data gained from this process provides insight into adjustments for Tier 1 core instructional delivery or intervention needs. This data also aids educators in selecting appropriate research-based interventions that target specific skills, which are needed to help students meet grade level expectations. This offers wraparound services and shifts the intervention focus from a traditional service-driven, problem-based approach to instead a focus on student strength-based and needs-driven approach. The intent is to build on the individual's strengths and to help them achieve positive goals by improving their overall well-being. Strength-based planning is driven by the student and their family. This offers unconditional support, community-based services, and has a foundation of collaboration amongst team members. Let's talk a little more in depth about what each tier looks like. Let's start with Tier 1. Tier 1 support prioritizes instructional practices for all students and focuses on prevention prior to intervention. By incorporating evidence-based teaching strategies, we promote academic success as a preventative measure which develops foundational skills. These strategies include differentiated instruction, because students have different levels of background knowledge and school readiness. By differentiating instruction, we're engaging each student in active learning according to their needs. The content of instruction, delivery, and the targeted level of instruction can also be differentiated. By having flexible grouping, we offer a combination of whole group, small group, and individual instruction, which allows teachers to create fluid groups that meet the needs of all students. Active student engagement ensures that all students are actively involved during instruction and not simply passive recipients. This can be accomplished with high rates of opportunities to respond, ample time to practice skills, and prompt corrective feedback. Classroom behavior strategies such as frequent use of reinforcement and praise, and that means that praise should outnumber criticism, typically in a 4-to-1 ratio. Offering quick and efficient transition times, and consistent instructional response to misbehavior are all evidence-based strategies that proactively and explicitly teach expected behaviors and routines. If our ongoing data reveals that students are not showing a response to the Tier 1 intervention, it's recommended that you communicate with your MTSS coordinator. We do work in a small district, so it is possible that you often see your MTSS coordinator informally just around the school. Please be sure to ask for a Tier 1 data collection sheet from your MTSS coordinator. But in addition to just seeing our teammates around our school, we do have the opportunity to discuss student concerns at our grade level biweekly planning meetings that involves our MTSS coordinator and our other teammates. It's important to establish ongoing communication with not only our team, but our students' families so that we can share information and offer those wraparound services, keeping them informed of their students' progress and possible resources that we may offer here in school or in the community based on their specific needs. Offering a high-quality instruction is critical in ensuring that 80% of the students' needs are met at Tier 1. A solid Tier 1 should be sufficient to help 80% of our students meet or exceed grade level expectations as measured by a standardized summative assessment. If our data reveals that our student is not showing a response to Tier 1 intervention, a recommendation may be made by the MTSS coordinator to then progress to Tier 2. So at this point, you've now been part of the Tier 1 intervention process with your MTSS team, attending your biweekly meetings and communicating across team members and family about strategies you're implementing. And we have identified some specific students who do not seem to be responding appropriately to the Tier 1 intervention. Let's look more closely at what Tier 2 intervention consists of. When an at-risk student has been identified, it's important to provide them with research-based interventions in addition to their core curriculum instruction. Multiple strategies can be used to identify students for Tier 2 support. Some examples are discipline referrals, screening instruments, formative assessments such as weekly probes or quizzes, as well as teacher nominations and parent support or service provider recommendations. Approximately 5 to 15% of your students will need supplemental instruction at a Tier 2 level support for progression. Tier 2 targets intervention through small groups. They typically receive an additional 60 to 90 minutes of instruction on top of their core curriculum instruction each week. This is going to look different across grade levels and classrooms. Some teachers may implement 2 or 3 30-minute intervention periods, and other teachers may have different ways to chunk those small group strategies. Small groups become more intensive by increasing the amount of support in the form of encouragement, feedback, positive reinforcement, which is carefully scaffolded during instruction. At the elementary level, small groups should be approximately 3 to 5 students. Then at the middle and high school, the Tier 2 groups are broken into groups of 6 to 8. It's essential to incorporate these flexible grouping strategies of students that are demonstrating common skill deficits or even social, emotional, or behavioral risk characteristics that they're sharing. By increasing collaboration with team members and documenting the intervention plan and progress monitoring, this all contributes to fluidity across the tiers. It's essential at this point to obtain an MTSS documentation from your MTSS chairperson. Continue your data collection of a specific evidence-based intervention for 4 to 6 weeks. We have already established communication with our family and team members, so continue engaging in that ongoing communication with your student's family. And then, if there is a continued lack of progression, we're going to request a formal intervention documentation form. At this point now, we've been ongoing and active in our MTSS intervention involvement with our teammate and family members. We've implemented more than one evidence-based intervention strategy, and we have our ongoing data collection to indicate the response to those interventions. And now we've reached Tier 3. Working with your MTSS coordinator, you may determine to try an alternate evidence-based intervention strategy, or you may be considering a referral for special education evaluation. Now we have reached Tier 3. If you are not seeing the response to appropriate interventions that we had hoped for or expected, it's essential to schedule time to sit down and review your formal intervention documentation form with your MTSS chairperson. The MTSS chairperson will then schedule a meeting with your family and team. And at that meeting, we're going to determine the student's specific needs and discuss alternate intervention strategies or request a formal evaluation from the school psychologist. For the next portion of this presentation, I'm just going to introduce some informational resources across academic and behavioral interventions, as well as some different learning strategies. When teaching reading, it's important to know the components of comprehension so that you may better assess and teach them. Children typically have reasonable oral language skills when they start school. However, they don't have all the language skills in place that are needed for comprehension of text. Written texts are different from conversation and require specific cognitive skills. For example, in written language, syntax and vocabulary are more complex. There's no expressive cues like vocal annotations, and written text has to describe the setting and time. The two skills of word recognition and language comprehension contribute differently to overall reading across time. Oral language comprehension is usually relatively well developed when kids begin school, and this is unlikely to be a source of difficulty when they're reading simple books that are given to beginner readers. However, for beginner readers, decoding and word recognition will be brand new. So reading comprehension is almost entirely predicted by word reading in the early school years. However, once accurate word reading is established, language comprehension plays a much bigger role. Written expression is a critical component to a child's academic success throughout their school career. If a child cannot form letters with proper legibility and an adequate speed, they cannot translate their thoughts into written text. It's imperative for young readers to decode fluently so that they can focus on comprehension. And similarly, once young writers develop fluency, legible handwriting, then they can master other transcription skills like spelling. It's important for students to also receive evidence-based strategies and supports to learn planning strategies for organizing their thoughts. After progressing spelling skills, they can focus on generating and organizing ideas. Students should be taught the correct use of relationships of words and sentences, text structure, and benefit from explicit instruction in revising and editing these strategies. Students also benefit from explicit instruction for brainstorming and organizational information, and this can be obtained through a variety of sources, and this includes note-taking strategies, annotation skills, and presentation skills. As students develop these skills and these components are combined, they become increasingly strategic and automatic in their application, which leads to fluent writing skills. Here is a quick visual guide for Tier 1 academic resources. They are all from interventioncentral.org, which is a reputable website that includes links and supportive information for all evidence-based intervention strategies. This can be a quick guide to reference when thinking outside of the box or considering alternate strategies or options. It is important to remember as well that we do implement iReady here in our district through the elementary and middle school levels. And iReady has several intervention strategies, including the teacher toolbox, as well as flexible grouping recommendations and scaffolded supports for teachers that they may print out to address specific deficits in small group instruction. I hope that this is helpful. This does not include all interventions. It is just simply a guide of some different things out there to get your gears turning. Intervention Central does offer both academic and behavioral evidence-based intervention resources. Here I have included another quick visual reference for behavioral support in our Tier 1 setting. I have seen various teachers at different levels in our district implement strategies such as these with success, and always recommend these as a great starting point. As I had mentioned previously, there is a fluidity to the MTSS process. There may be some students who progress through the tiers, say going from a Tier 1 to Tier 2 to Tier 3, then maybe digressing back to a Tier 2. Or there are those other students who continue progression, Tier 1, Tier 2, Tier 3, to a referral for psychoeducational evaluation. That is why it's critical to have communication with your MTSS chairperson and family and engage in ongoing progress monitoring and data collection. There are multiple strategies that can and should be used to identify students for Tier 2 supports. Those examples would include our formal intervention documentation form, in addition to formative assessments, discipline referrals, other screening instruments, and of course, teacher, parent, or support service provider recommendations. I hope you found this presentation to be supportive and informational on how the MTSS capacity and infrastructure is set up here in LADA. This is a brief chart that breaks down the areas that we should be looking at when considering the MTSS process and the characteristics of the student's learning environment. Here are two hyperlinks for reputable intervention website resources. I encourage you to explore and collaborate with your MTSS chairperson.